If you think your biological age is determined by how well you walk on the golf course or the wrinkles around your eyes, you are missing the most accurate warning system in your entire body. The truth is, your bladder is a direct window into how your blood vessels, your brain, and your nerves are actually holding up after 60. Most seniors assume that getting up 3 times a night is just an annoying tax you pay for getting older, but it is often the first silent alarm that your cardiovascular system is working double time. I am Dr. Carl. I have spent 16 years in clinical practice as a urologist, helping thousands of active men and women navigate the realities of aging without losing their independence. Today, we are going through the 8-part bladder aging test that you can perform right at home to see where your body truly stands. We will break down exactly what your daily habits say about your internal health, and I want you to pay special attention to number 6 because it reveals a hidden structural issue that many seniors completely mistake for simple muscle weakness. Before we dive into the first check, do me a quick favor and drop a comment below, letting me know how many times you typically wake up to use the bathroom on a normal night and what city or state you are watching from. I read every single comment myself, and your real-life experiences directly shape the topics I cover next to make sure this channel remains a useful resource for your daily life. The first part of our test looks at your midnight wake-up frequency, which is just what we call waking up in the middle of the night to pee. When you are 40, your body produces a natural hormone that slows down urine production while you sleep so you can rest deeply. But after 60, that hormone naturally declines. However, if you are waking up 3 or 4 times every single night, it is not just a simple bladder issue. It often means your heart and blood vessels are struggling to pump fluid efficiently during the day, causing it to pool in your lower legs until you lie flat at night. Research from the American Urological Association shows that frequent nighttime urination is strongly tied to broader systemic health changes rather than just an isolated bladder problem. To test yourself this week, keep a small notepad on your nightstand and track the exact number of times you get up for 7 days straight. If the number is consistently above 2, it is a great piece of data to bring to your next annual physical. Of course, you should always have a conversation with your doctor before changing how or when you take any prescribed medications, especially blood pressure pills. Next up is your stream speed and force, which measures the actual strength of your flow. Think of your bladder like a balloon that relies on a healthy muscular wall to push fluid out. As we get older, that muscle tissue can gradually be replaced by stiffer connective tissue, or in men, an enlarging prostate can put the squeeze on the exit pipe. If you find yourself standing at the toilet for an extra minute waiting for things to start, or if the stream feels more like a slow trickle than a steady flow, your bladder muscle is working against major resistance. Studies published in the Journal of Urology indicate that a weakening stream is one of the most reliable indicators of pelvic tissue aging. An easy action step this week is to time your next few trips to the bathroom. A healthy, uninhibited void should take less than 30 seconds from start to finish. If you are consistently taking much longer or straining to empty completely, it is a clear sign your bladder muscle is working overtime to overcome an obstruction or loss of elasticity. The third marker is your post-coffee urge velocity, which is how your system handles bladder irritants like your morning coffee or that afternoon iced tea. When your bladder lining is healthy and youthful, it acts like a well-insulated thermos, holding fluid comfortably without sending urgent distress signals to your brain. But as we age, that protective lining can thin out, and the nerves surrounding the bladder can become hypersensitive. If you take 3 sips of your morning brew at the club and suddenly feel a panicked rush to find a restroom within 10 minutes, your bladder lining is losing its protective barrier and communicating poorly with your nervous system. A Mayo Clinic review highlights how nerve signaling and tissue sensitivity alter significantly in our senior years. This week, try swapping your regular coffee for a low-acid variety, or a glass of water for just 3 consecutive days, and note if that sudden, panicky urgency drops down. If the urgency fades, your bladder tissue is highly sensitive, but completely manageable with small dietary tweaks. Number 4 is a behavioral trap I see so many financially comfortable, active seniors fall into, and that is the habit of peeing just in case. You are about to get in the car for a 2-hour drive to see the grandkids, or you are heading out to the first tee, so you force yourself to go even though you do not really feel the urge vehicle darted. While it feels like a smart safety measure, you are actually shrinking your bladder's functional capacity over time because your brain starts to map that smaller volume as the new maximum limit. Research has linked this constant preemptive emptying to a progressive loss of bladder compliance and a higher frequency of sudden urges. Your action step this week is simple but requires some discipline. Stop the just in case trips for 5 days. Only go when your body sends a genuine, distinct signal that it is full. You will be surprised how quickly your bladder can relearn its proper boundaries when you stop micromanaging it. The fifth element of our test is looking at the relationship between the color of your urine and the frequency of your urges. Many health-conscious seniors pride themselves on drinking massive amounts of water, aiming for completely clear urine all day long at the pharmacy counter advice or from wellness blogs. But if your urine looks like pure tap water and you are running to the restroom every 45 minutes, you might actually be overhydrating and flushing out essential electrolytes, which ironically irritates the bladder muscle and forces it to contract prematurely. The kidneys become less efficient at concentrating urine as we cross into our 70s, meaning balance is everything. Try adjusting your fluid intake this week so that your urine is a pale, straw-like yellow rather than perfectly clear. You might find your daily trips drop from 12 down to a much more comfortable 7 or 8, giving you your freedom back during day trips. Let us take a quick pause right here. If these insights are helping you connect the dots about your own body, please tap that like button. It truly helps this information reach more seniors who are trying to stay active and healthy. And if you have a second, tell me in the comments if you have ever caught yourself doing those just-in-case trips before a long road trip. Now let us talk about number 6, the one I told you to watch out for, which is the leak during movement or a laugh. Many seniors assume that a tiny leak when you cough, laugh, or swing a golf club is just an unavoidable consequence of getting older, but it is actually a precise measurement of your core structural support and pelvic floor health. Think of the pelvic floor like a hammock supporting your bladder. Over time, that hammock can sag due to changes in deep muscle tissue and systemic aging. Some studies suggest that even mild core weakness can manifest first as a tiny bladder leak during physical exertion. This week, pay close attention to your body during sudden physical movements. If you notice a leak, do not just accept it as a normal part of getting older. Consider asking your doctor for a referral to a pelvic floor physical therapist during your next Medicare visit, a simple step that has saved many of my patients from giving up their favorite outdoor activities. The seventh part of our test involves looking at your ankles at the end of the day to check for a nighttime fluid shift. If you notice your socks leave deep indentations or your ankles look a bit puffy after an afternoon on your feet, that trapped fluid is going straight to your bladder the moment you lie down to sleep. As we age, our circulation naturally slows and gravity pulls fluid downward during the day. When you transition to a horizontal position in bed, your heart has an easier time moving that fluid, which your kidneys quickly process into urine. Medical reviews have shown a strong link between daytime fluid retention and severe nighttime bladder disruption. This week, try elevating your legs on a couple of pillows for just 30 minutes in the late afternoon. This helps your body process that fluid while you are still awake, so you can empty your bladder before bed and get the uninterrupted sleep you deserve. Finally, the eighth marker is distinguishing between a bladder that wakes you up and a brain that wakes you up. Many seniors report waking up at 2 in the morning and thinking, well, since I am awake, I might as well go pee. In reality, it is often a light sleep cycle, mild sleep apnea, or minor joint discomfort that woke you up first, and your brain simply blames the bladder because it is an easy signal to recognize. Clinical studies suggest that sleep fragmentation is frequently misdiagnosed as an overactive bladder in older adults. For the next few nights, when you wake up, pause for a moment before getting out of bed and ask yourself if your bladder is truly full or if you are just awake and looking for a reason to get up. If it is the latter, focusing on your sleep hygiene or room temperature might fix your bladder issue completely. Let me tell you about a real patient of mine named Arthur to show you how this works in practice. Arthur is a 72-year-old retired executive who spends his winters down in Naples, Florida. He came into my office completely frustrated because his nighttime trips had increased to 4 times a night, and he was terrified he was losing his independence and would not be able to enjoy his morning rounds of golf anymore. He thought his bladder was simply failing due to old age. After running through this exact self-test, we realized Arthur was overhydrating late in the evening and suffering from a classic nighttime fluid shift. We made 2 simple adjustments. He moved his larger water intake to earlier in the day and spent 30 minutes reading with his legs elevated before dinner. Within just 3 weeks, Arthur went from 4 nightly trips down to just 1. He got his deep sleep back, his energy returned, and he was back on the golf course without a single worry. To help you get started on your own journey right away, let us look at tonight's plan with 5 simple, concrete steps you can take starting today. First, stop drinking all fluids exactly 2 hours before you plan to close your eyes for sleep. Second, skip the just-in-case bathroom run before you head out the door tomorrow morning. Third, track your exact number of nighttime wake-ups for the next 7 days on a notepad by your bed. Fourth, spend 20 minutes tomorrow afternoon resting with your feet elevated above your heart. And fifth, make an appointment for a regular checkup if you notice your urinary stream is consistently taking longer than 30 seconds to complete. In our very next video, I am going to share the single most common over-the-counter supplement that millions of seniors take every day that is secretly irritating your bladder lining and making you feel like you have to go twice as often. You will definitely want to check your own medicine cabinet after watching it. I am Dr. Carl. Stay well, and I will see you there.